access that report. So we're going to start with the summary dashboard. So your dashboard might look a little bit different when you open this up, specifically because you are only going to be able to see information associated with your team assignment. So saying that, all data is pulled from those team assignments, meaning any consumer that you have is actually allocated to a team in which they are assigned. So your view should automatically include your team assignment. And if you're assigned to multiple teams, you'll see this filter over on the right-hand side. You will have a drop down to choose which team you would like to select, and you would do that just by clicking on it, just like that. So left clicking the one you're looking for, that will actually filter the data just to your specific team that you're looking at. Another important piece of information, data refreshes each night from our data warehouse. What that means is that anything done today is not going to reflect until tomorrow in the dashboard because it cannot be constantly refreshing. This is going to be as up to date as we can get you from the system. Like I said, it's going to refresh each night. One other piece of information, if you have multiple teams that you're looking at or that you have consumers assigned to, you can select multiple teams by doing this drop-down menu and holding down the control button. That will allow you, and anytime there is a drop-down for filtering, holding down the control and left clicking is going to allow you to do a multiple selection each time. Again, I'm just going to get everybody. Also, you can support in terms of actually sorting information. We'll get to that a little bit later, but you will also have this primary staff filtering. Depending on your access, this might or might not be available. You can clear filters just by clicking this little erase button if you want to get back to square one. So just go ahead and left click that. So an overview of the summary. So in terms of our summary page, this really includes multiple key performance indicators that you'll find helpful as a team overall. So these include the number of consumers that were admitted to the team in the last 180 days, the number of current open consumers to your team. Again, I'm showing all information. This is not just filtered to a team, so your dashboard might be a little bit different and numbers will be different. So this is for the whole agency. So the number of open consumers that we currently have, the percentage of psychosocials completed on time. So this is the number of psychosocials that have been completed within 365 days of the previous psychosocial. Same thing for percentage of PCPs completed on time. We also have the number of consumers on active court orders, so you can see that for your specific team. We have the number of court orders expiring within 60 days, and the number of consumers not seen in the past 90 days. Overall, the actual charts that you see in the graphs, you're going to see the consumers by county, the breakdown again, just for your specific team. So these are going to look just a little bit different. You are able to hover over any of the bar charts, and that's going to show you the number of consumers open specifically within that county and that are currently being served. The number of inpatient admissions within the last 180 days, these are psychiatric inpatient admissions based off of our end of episode documents. So this is information where you can hover over this again to see how many consumers that have had one admission in the last 180 days for your team and so forth. There are cards on the right-hand side that are quality metrics around compliance. So specifically, we wanted to be able to share what is coming due in the next 30 days, 60 days, 90 days, and what is overdue. You are able to right-click on this, and I'm not going to drill through because that will show consumer information at the moment. So just so you know, you can right-click for your team, select drill through, and then click on document timeliness. That is going to bring you up a full list of consumer information who is coming due in 30 days for the locus. You can do that for each of these different metrics. So you'll be able to see what's coming due in 30 days, what's due in the next 60 days, 90 days, and overdue. These do build on each other. So if it's due in 30 days, it's also going to show up and due in the next 90 days as well, along with 60 days. So for these cards up at the top, so you are able to left click. If you left click, that is going to give you a list of consumer information. So I'm going to share an example of this. So if I was to select the open consumers because I'm interested in seeing who is currently open on the team, this is what it's going to come up as. So you're going to be able to see, and I'm blocking out all confidential information, so you're not able to see this, but these will have information, these columns will have information in them for you. The consumer IDs will come up along with the consumer names, their gender, county of service, who their psychiatric staff is that is assigned to them currently, if they do have psychiatric staff assigned to them, the consumer's age, date of birth, nursing staff, and what their last PCP type is. Again, you have filtering available to you in any of these reports. You'll see that in the boxes. So for this report specifically, there is a team dropdown along with primary staff dropdown. Selecting that back arrow is going to get you back to the summary page. You can also click on the reports and then go back to the team-based care dashboard summary if you need to get back to this home summary page. Just as an example of this drill through option, I'm going to show you the locusts that are due in the next 30 days so you can see what comes up when you click this document timeliness section of the dashboard. So this is going to be what comes up when you see that. You're going to, again, we have some information blocked out here, but there will be data in those fields. You'll be able to see consumer IDs, consumer age, consumer name, county, primary staff, document type, what the date is of the document being needed to be completed, gender, birth date, and some other additional information. Of note, if you scroll down, there is a right-hand scroll tab. Again, this is not live, so I can't show you this functionality, but there is a right scroll tab that you're able to bring over. There are some additional fields that you can bring up when you do that. Again, filtering on this one includes primary staff as well as team. And to get back to the team-based care dashboard, all you need to do is click this back arrow button. So that will get you back to the summary page. I do just also want to mention for the progress reviews and psychosocials, we did have feedback. We wanted to make sure that we took all of the feedback into consideration. So we know that this is a work in progress. So if there is anything that you see that is incorrect, please let us know. I'll plug that again at the very end of this. This is a new thing for us, so we want to make this as useful as possible. So one of the things that came up from our team-based care champions when they were reviewing this information was that for progress reviews and for psychosocial reviews that were coming due along with overdue, previously that was including meds only consumers along with like Clubhouse consumers and respite. Those have been officially taken out. So the only individuals who come up within these overdue along with due for those psychosocial and progress reviews are the specific consumers who it applies to. So moving on to some other areas and graphs that you now have access to on this summary page, you are going to see the number of successful closures by month. And this is going to give you a trend over the last year. If you hover over this, again, it's going to show you the number of consumers. The number of successful closures is being, in terms of the actual definition of what a successful closure is, it's being looked at by the closing report and PCP goals being met and the consumer meeting their full plan of service. So that is what is being counted as a successful closure. The number of appointments graph was asked to be added by our clinical staff in terms of making sure that you can see the number of appointments that are coming due within the next 0 to 7 days, along with the next 8 to 30. So this actually breaks down the purpose of the appointment by those two categories. So this will show you the number of consumers. Your numbers will be hopefully much smaller than this because this is overall, but this will show you the number of consumers that are coming due for just a generalized service in the next 7 days. The blue chart is going to show, or the blue color is going to show you the 8 to 30 days, and then so on and so forth. So you'll be able to see the actual number of first service appointments if you hover over that coming due in the next 7 days, along with the next 8 to 30 days if you just hover over each of those different bars and colors. So same thing for injection, groups, med reviews, assessments, that sort of thing. Over on the right-hand side, this bar chart is going to show you the percentage of appointments kept within the last 30 days, around, as well as the number of appointments kept within the last 30 days. So you're able to see for your team the percentage where there was client present, staff only, no shows, broken down by that different attendance code. Again, you can hover over that to be able to see the number of consumers where you had appointments kept within the last 30 days. All right, and finally, the very bottom section is the number of PCPs coming due by month over the next year, number of progress reviews due by month, and psychosocials due by month. This was something that the clinical teams thought would be very helpful in terms of looking forward. So being able to see what is coming due over the next several months, to be able to plan just in case you have spikes in documentation for certain months that you could potentially move around, to make sure that you're serving the consumers to the best of your ability. So the PCPs due by month, again, you can hover over to see the number of consumers. This is just going to be reflective of each of these data points. One thing I do want to mention, there is a detail tab. again, this is going to bring up a list of consumers who are coming due for each of those months. So I'm going to go into one of those now. So if you were to click that detail tab just to show for the progress reviews due by month, this is what would come up. So you're able to see the consumer ID, name, age, gender, team, all of that information, along with the number of days it's coming due within. So you're able to see all of that information along with what is due for the next date and where it was previously completed. So you're able to see that as well as get this information. One thing that I do want to mention is that you are able to export any of these lists into multiple different formats. So I'm going to go back to the summary just to kind of show you how that will break down. So to export any of these reports, which summary is a little bit more difficult to export just because it's summarized information. So this is going to be really helpful for when you're actually looking at those detail lists or specific individualized reports. So you are able to export to an image file, a PowerPoint file, a CSV. So CSV is an Excel document type. So you're able to bring this into a spreadsheet to be able to filter and move things around if needed, or a PDF. So you do have multiple options that you're able to pull information for to be able to get down to that really specific consumer level data. So now I'm going to be going into each of the individualized reports. So we'll be starting with the outcomes tab.